Of the education and outreach part of this project was a workshop for the Swinomish Primary Care Provider Clinic. As news of the project spread in the community, we wanted to ensure that the Swinomish primary care providers were not overwhelmed with unanswerable questions about the effects of the possible contaminants, implications, and what could be done to avoid them. Chris Walsh, a registered nurse from the Yakima Nation Indian Health Clinic and involved in the education and outreach at Yakima regarding fish consumption in the Columbia River, traveled to Swinomish to perform the workshop. She brought with her the experience and expertise of how to field questions related to the project, as well as offering pamphlets and info for ways to prepare fish that cut out more contaminated parts. She promoted eating traditional foods such as fish and shellfish, as well as promoting breastfeeding because the benefits of these activities outweigh the potential risks from the toxics. The workshop, which was held in January of 2005, also screened the film Sacred Salmon, which is about the Yakima's project investigating toxics in their food and mitigation measures. Getting back to another aspect of the project, we focused our efforts on evaluating the risk assessment equation and how we wanted to alter it to better suit and determine exposure risks to the tribe. We took the commonly used risk assessment equation, which is dose times toxicity equals risk, and tailored it to more adequately address Native American exposures. First, we worked on some simple modifications, such as using higher environmental exposure time since tribal members spend more time outdoors than the average American, and a 70-year exposure duration rather than the normal 30-year suburban one, since most tribal members spend their entire lives living, harvesting, and eating from the local waters. We also plan to employ higher consumption rates since previous fish consumption surveys documented that Puget Sound area tribes eat up to 20 times the amount of fish and shellfish as the average American. Therefore, the average American fish consumption rates simply were not high enough. As we explored the fish consumption issue more, however, we quickly realized that the rate we planned to use, which would be an average between the Swinomish tribal neighbors, the Tulalip, and the Swinomish tribe, would not be accurate in depicting the Swinomish tribe's consumption. As you can see, there's a wide variety of consumption rates that are available. Now, some of the issues that arose with using the Tulalip and the Swinomish surveys are that in the Tulalip survey, the highest consumers were recoded to lower rates, as it was thought that perhaps survey respondents were mistaken about how much they ate. Basically, what the survey providers did was not believe that people could possibly be eating the large amount of fish and shellfish that they had reported, amounts equivalent to the amounts eaten in the past. Simply asking a nebulous question as how much do tribes eat sets the stage for collecting the wrong information. If the purpose is to evaluate the current public health status, data and collection methods will focus on current seafood consumption rates. This may be used to respond to current exposure levels such as emergency intervention measures. However, it must be recognized that current rates are suppressed due to a number of reasons, including loss of access and availability, intimidation, persecution when participating in harvesting, and fear of known contamination. We knew that we needed current rates to figure out the current exposure risk. We realized that we also needed the desired rates, the treaty-guaranteed rates, because these were the rates that are necessary to use when setting policy standards or cleanup levels in order to protect a culture. Treaties between tribes in the United States require that the federal government ensure the protection of human health and natural resources for Native Americans in perpetuity, at the same availability and access as when the treaties were signed. The second issue is one of survey methods. Using the current collection methodology provides inaccurate data for a number of reasons. Based on all of this, we decided to create our own collection and analysis method called the Swinomish Seafood Diet Interviews. This method is Swinomish specific, but the framework can be tailored by other tribes wishing to perform their own surveys. A few specific methods we employed in the Swinomish seafood interviews are true and informed consent. The knowledge a community holds is as valuable as what you bring to the table, so above all, we recognized, respected, and upheld the community's wishes. We hired and trained community interviewers so that interviews were conducted by tribal members and staff in the comfort of the interviewee's own home. We used an open-style oral ethnographic interview method consisting of a flowing conversational style with a combination of quantitative and open-ended qualitative questions. In all, we conducted a total of 104 interviews with both adults and children. Considering the size and scope of this mid-project undertaking, we finished initial data analysis just before the project ended, leaving us with initial results with which to roughly calculate current consumption rates for use in the risk assessments, but not enough time to formally write up our methods, perform detailed analysis of the data, or publish the results. We hope to procure funding in the near future to complete this component. So now that we had a rough estimate of the Swinomish's current consumption, our toxicologist and risk assessor performed the risk assessment. Risk was fairly uniform over all of the sites that we sampled. The slightly higher risks in the Padilla and Fidalgo sites were masked by rounding in the end, and so this was not really reflected in the outcome of the data. In the clams, the non-cancer risk driver was overwhelmingly and uniformly PCBs and arsenic, followed by dioxins and then mercury. Cancer risk is driven by polyaromatic hydrocarbons, followed by arsenic and PCBs. Tributyltin is also a concern in some locations. Steamer clams were generally slightly cleaner than butter clams. In the crabs, non-cancer risks were driven by arsenic, followed by heavy metals, mercury, lead, selenium, and copper, dioxins, chlorinated pesticides, PCBs, and PAHs. Cancer risk was driven by arsenic, followed by dioxins, PCBs, and chlorinated pesticides. Crabs seem to bioaccumulate more contaminants, especially arsenic. Crabs may also be exposed to thicker and older sediment from deeper waters. Crab hepatopancreas was uniformly higher than crab muscle in many contaminants. After the risk assessments were completed, the results went through the Swinomish Health and Education Social Services Committee, the Cultural Resources Committee, and the Swinomish Tribal Senate for approval before being released. Results were released on the cable channel, in the Keoaks, and on the Swinomish website, and disseminated via word of mouth at gatherings. One such gathering was the Clam Bake held in August of 2006. Clam bakes are a traditional event in which shellfish such as oysters and clams are baked on the beach by digging a large pit in the sand, loading hot rocks from a fire, then steaming the shellfish in the pit. Crabs, salmon, fry bread, and other goodies were also served. The clam bake was held at Lone Tree Point, one of the most heavily trafficked clam digging areas on the reservation, and thankfully, one that has lower levels of contamination. Developing mitigation measures is one aspect of this project. Advisories on a short-term basis are a necessity but not a long-term solution. Cleanup is the solution. Throughout the project, we have extolled the virtues of eating fresh fish and practicing cultural activities, while recommending locations to harvest that are less contaminated. In the qualitative component of the seafood diet interviews, the overwhelming majority of the people talk about the important links between well-being and seafood harvest and consumption. As several tribal elders have told us, seafood not only feeds the body, it feeds the spirit. The overall recommendations are primarily location-based rather than species-based. Although there are some differences between butter clams, steamer clams, and crabs, they are not different enough to make species-specific recommendations. Station 9 on March Point should not be used at all. It is clearly contaminated. The Skagit Bay sites are somewhat more preferable to the Fidalgo and the Padilla Bay areas. Heavy use areas around marinas, ferry docks, and industrial areas should be avoided. The crab hepatopancreas should always be removed before cooking the crab. The intake of locally gathered clams and or crabs should be limited to an average of twice a week, assuming 3 or 4 ounce portions for children and 8 ounce portions for adults. The fourth specific aim of the project was to confirm major health problems on the reservation that may be related to eating contaminated shellfish, and develop hypotheses between the health problems and the toxics found. Unfortunately, the federal government, as well as the tribes, have failed to maintain a robust health assessment and health statistical data system for tribes, both in congregate and individually. Therefore, this fourth specific aim was impossible to complete. Next steps include finishing the Swinomish seafood diet interviews, building capacity and sustainability of the Swinomish Environmental Educational Program through the creation of a community oversight committee and review panel headed by the environmental educator that will guide the program's future priorities and directions. Longhouse Media and Native Lens will continue their work with the Native youth while seeking long-term financial stability. In addition, the tribe has passed a resolution to create an alternative new framework based on the concepts of community health and well-being and health promotion that will more accurately depict the connections between human health, culture, and the environment here at Swinomish. In conjunction with the creation of an alternative framework, we will also make policy recommendations about how to support and bolster these connections to improve the health and well-being of the community, to protect the natural resources, and to uphold the treaty trust and responsibility.